In these video clips on examination basics, we've not discussed too much in the way of joint play, either for the extremities or the spinal motion segment. But there is one joint play procedure, passive segmental translation, that we need to discuss briefly with regard to the lower cervical region. Discogenic instability, secondary to early grade disc degeneration, is one of the most common causes of neck ache. We're able to really strengthen our diagnosis if we apply a test called passive segmental translation. It's relatively easy to perform. We approach the patient who's in a seated position from the side and from the front, and using a nice relaxed quack hand, which we like to call, we make a forward and backward translation of the cranial vertebrae on the caudal. I'm moving C2 on C3. Okay. And then we can test for excessive translation in a posterior direction or in an anterior direction at that same motion segment. Again, when a disc begins to degenerate, vertebrae tend to slip slide on one another too much. That potentially can be a source of discomfort. And what we do with this test is go to whatever segment you want to test, or starting at C2-3, we could move down to C3-C4, C4-C5, C5-C6, and so on. If a motion segment translates very easily or demonstrates excessive translation in one direction or another, it's pretty easy to conclude that the disc, which is the principal stabilizing structure of that segment, is not able to do its job any further. Pattern recognition tells us that the majority of time, and this was discussed in the flexion and extension video clip, that we're going to find painful instability at the C5-6 and the C6 C7 motion segment most of the time on our patients. So this is very much like the Lachman's test for the knee. Okay? You need to develop an experience level with judging how much translation is too much and whether or not that translation feels very loose, okay? And additionally, whether that translation bothers the patient's motion segment, because if a segment's irritated, it may very well reproduce some of their symptoms. Lastly, when doing the passive segmental translation technique, if you found a motion segment that translates quite a bit in either a posterior or an anterior direction, stop the movement and palpate the interspinous space and see if the interspinous space is tender. In most cases of symptomatic discogenic instability, that interspace is going to be tender.